Treatment with PARP inhibitors plus novel hormonal agents can provide combination benefit in metastatic castration-resistant prostate cancer patients with homologous recombination repair mutations, otherwise referred to as HRR mutations, as well as in an all-comer population. A number of Phase 3 trials have investigated these combinations in first-line metastatic castration-resistant prostate cancer, or mCRPC patients. These are the PROPEL, Magnitude, TALAPRO-2 and CASPER trials. PROPEL investigated olaparib plus abiraterone, compared with abiraterone in patients with mCRPC. Patients could have received docetaxel earlier in their disease, but no prior abiraterone was allowed. Patients had their HRR mutation status evaluated after randomization. The combination of olaparib plus abiraterone demonstrated a radiographic progression-free survival benefit for all patients regardless of HRR mutational status, and an overall survival benefit. Subgroup analyses suggest a greater radiographic progression-free survival benefit in patients with HRR mutations, particularly those with BRCA mutations, who tend to have worse outcomes on standard of care. The safety profile of olaparib plus abiraterone was consistent with the safety profile for the individual drugs, with no detriment to quality of life. Magnitude investigated niraparib plus abiraterone compared with abiraterone in mCRPC patients. The dose of niraparib used in Magnitude was lower than the usual monotherapy dose to allow it to be safely combined with abiraterone. Patients could have received docetaxel earlier in their disease and up to 4 months of prior abiraterone for mCRPC. HRR mutation status was determined prior to randomization. No benefit was seen in the patients without a HRR mutation. However, the combination of niraparib plus abiraterone demonstrated a radiographic progression-free survival benefit in patients with a HRR mutation. Overall survival data was immature. The safety profile of the niraparib and abiraterone combination was consistent with that of the individual drugs, and quality of life was maintained. Initial results from TALAPRO-2 suggest talazoparib plus enzalutamide provides a radiographic progression-free survival benefit compared with enzalutamide in first-line mCRPC patients. The CASPER trial investigating rucaparib plus enzalutamide is currently ongoing and will provide additional information regarding the use of PARP inhibitors in combination with novel hormonal agents. PARP inhibitors combined with novel hormonal agents are effective as a first-line treatment option for metastatic castration-resistant prostate cancer patients with an HRR mutation. Certain combinations have also shown benefit in patients regardless of their HRR status.